A blockbuster new report says that health centers at a major school district is offering gender-affirming care to students, while one group says this is happening across the country with their calling school-to-clinic pipeline. Joining us now is Michele Exner, a senior advisor from Parents Defending Education. Thank you so much for joining us here on the National Desk. This morning, I had a chance to go through at least one report from the Daily Wire, obviously a conservative website, about Neighbor Care, an organization that operates clinics inside of Seattle public schools, is now apparently offering gender-affirming hormone treatment. Now, your organization actually put in some public records requests to get more data about this. What did you find out? What was sent back to you?
Absolutely. So about a year ago, it turns out that this organization had sent out a notice to all the schools. There's 14 schools as they provide school-based health services in, and they said they will now, quote, be providing gender-affirming care. Now, a huge issue with that, one of the safety concerns. I mean, these prescriptions, these therapies, so-called therapies, have been banned in the United Kingdom already. The National Health Organization in the UK has said we do not have enough evidence to demonstrate what kind of long-term effects this have on children. So it is banned there. And the fact that now this is being essentially distributed and available in schools in America is disgusting, quite scary.
When you talk about schools, just going on Neighbor Care's website, they say they run 14 school-based clinics in Seattle public schools and also Vashon Island School District. So this would be across the board at all these schools?
Yeah, that's what it looks like. If you go on the website, right, it has a series of services that they provide at these schools, and that now this is something that's provided to children, right? And the way they frame it, so-called life-saving therapy. I mean, that's not what this is, right? These are children. They should not be making decisions that are going to impact them potentially for life, right? These are irreversible, and that's something that's sometimes lost in this discussion. And so we, and that's why Parents Defending Education has stepped in, and we wanted to expose this to make sure that parents in those districts impacted, and also parents across the country are paying attention and aware of what's potentially being offered in their schools.
Now, one part of the Daily Wire story is that the company officials stated in an email, according to the Daily Wire, that its foray into hormone treatment for children would initially be a pilot program, and that the administration of irreversible drugs would only occur with parental approval. Your thoughts?
Sure. But just the fact that it's a pilot program, right? So now we're testing things out on children. There's no evidence to show what the long-term effects are here. And also, we're talking about schools. Why is this happening on school grounds, right? And by the way, there's federal funding. There's $50 million in the last appropriations bill that went to funding these school-based health centers, right? So there's a role for Congress to provide oversight and look at that as well, because these services should not be provided in schools, right? There are routine dental cares, routine physicals, right? As long as a parent's aware and okay with that should be okay. But the fact that now you have these very, very controversial treatments happening on school grounds is just wrong.
And I want you to give us kind of like a big picture view of this, something that your organization, other organizations call the school-to-clinic pipeline, because you're not only looking at Seattle, but you're looking apparently at other school districts across the country.
Absolutely. And this is just a mode to kind of put a bug in children's minds, right? Especially adolescents. I think we can all remember how complicated that time was. And so now if a child feels like they don't feel right, or perhaps they're depressed, I think there's going to be someone that's going to tell them, oh, well, perhaps you need this therapy, right? And that'll make you feel better. And that essentially is going to now, again, provide that pipeline, give them that idea that they need to do that school to clinic pipeline. And now we're talking about something that is going to be a long-term process that they're going to go through, and potentially something that they're going to regret when a couple of years down the line. And that's sad. I think parents should absolutely be aware of this.
Well, thank you so much, Michele Exner, Parents Defending Education, for your time and for joining us this morning.
Absolutely. Thank you.